So this patient, a 36-year-old gentleman, came from Uzbekistan. He had been having pain in both the hips since the last 2 years. Now, why this happened, we investigated and found out that he had COVID 2 years ago while he was in Uzbekistan, and he was given steroids as part of his treatment for that. Because of the steroids, the blood got thickened and he developed clotting of the blood in his small blood vessels of the ball of the hip joint. So because of that, the ball of the hip joint lost its blood supply, became necrosed, and the bone collapsed, causing arthritis of the hips.
Toshkentda 1 yil lichen oldim. Plazma bu yog'i Hindistonda tavsiya etib qoldi. Sanar International deb.
So when we evaluated him, got the X-rays and MRIs done, we got to know that it was a stage 4 avascular necrosis, with advanced arthritis of both the hip joints. This is a typical case in which we managed to do both the hip replacement surgeries in one single sitting in a very safe manner.
Тазобедренный суставы керамический американский qo'yib berishdi. Striker firmasinikini. Sanar klinikasiga, rahbariyatiga, hamma xodimlariga rahmat deyman. Operatsiya qilgan odam Rohit Lamba, unga alohida rahmat.
So all thanks to our anesthesia team, our medical ICU team, and the supportive physiotherapy team, we were able to manage this case wonderfully well. He had a both side hip replacement done in a single sitting, and he was up and about after the surgery next day onwards, and he's been having some very good pain relief, is making wonderful recovery, and on his path to the final outcome, which is a pain-free walking for the rest of his life.